Hi, I'm chiropractor Kalla, running the clinic Dr. Neck Pain here in Singapore. Today I just want to do a brief introduction video about talking about chiropractic and structural correction, how I operate these clinics, why I do this, and some of the upcoming videos that I would like to cover in the future. I started chiropractic school 1993. I was just turned 16 years old, one of the youngest students ever started in chiropractic school. Graduated in 1997 and I got my government license in 1999. I did the manual, what everybody does, this cracking and adjusting alone, doing some muscle stretch and muscle work. That's the way I started working in Sweden. I did that for a good 10 years over there, working that way. So I done this adjustment alone approach. Usually you get 3 to 4 sessions with a client in Sweden to get them well. So you do some combined muscle work with them. But what I noticed over time, doing that, initially you might fix a client, but they might come back after 2 years. And once you've done that a couple of cycles, I realized that the cycle time kept reducing and reducing for neck pain. And after a number of years of treating the same client, you might see them every 3 months. So there was nothing that sustainably held it together by doing this adjustment alone. So when I was in Sweden, I thought Stockholm was a bit small city to live in. I wanted to see more of the world. And I saw a job posting actually in Malaysia. And I went to visit them back in 2004. I started working with them in 2005, and they talked about structural correction of the spine. That's something the first I heard about it. I mean, we go to chiropractic school, we understand that the spinal curvature should have certain shapes, all the anatomy books talk about it, but I actually never heard about structural correction prior to that. And they started doing some very basic forms about it, but it was very fascinating, very interesting. They used some foam blocks and started bending people around them. For treatment, but that was kind of my first introduction into spinal correction, structural correction for the spines, and it was very fascinating for me. Then I got introduced to Clear Institute in 2007. I had already moved from Malaysia to Singapore in 2006. They had very rigorous education about how they did this. They had proper equipment for doing this, and they had very good results in pre and post x-rays. They could show structural correction on a consistent basis for scoliosis patients. So I did that for a good 10 years until COVID. And then I just focused during COVID just doing neck correction. And so in the past 10 years, what I did during my own clinic, doing the Clear Institute protocol, also evolving it for doing neck correction on patient full-time basis. So for the past 10 years, I developed my own treatment method of treating neck correction and getting very good results, great results in a matter of weeks for my clients. So I've done that for a couple of thousand patients, and so this is what I want to launch with this Dr. Neck Pain, and exclusively doing neck corrective treatment. So the science behind structural correction, I think structural correction treatment started with Pearl Bettibon, and then he had two very prominent teachers, was Harrison, I think his name is Deed Harrison, I think, and then Dennis Vaughan. Dennis Vaughan was the one who found a Clear Institute for treatment, but Deed Harrison started a CBP training. But he did also, I think he did his PhD in math, I'm not quite sure about that, but he did a lot of research papers of the structural correction of the spine. So he did a mathematical formula, looking at hundreds of spines and looking at what would be the ideal spinal curvature. So he actually published them in Spine. Spine is the #1 journal for orthopedic surgery, so it is very rigorously tested. They have multiple different research papers stating this for spinal corrective work and the structure of the spine. They even have actually a book. This is just a book for tractioners, corrective work for the spine, just for the neck itself. So they go at length talking about it over there, structural work of the neck. And they showed an average improvement. They had a number of papers in 2003 to 2007, I think. A couple of papers. So they do an average correction in 3 months of a certain amount of degrees, maybe 14, 15 degrees, 17 degrees in these papers showing for the neck curvature itself. So normal neck curvature should be curved like this, 30 to 40 degrees. But it's quite common that we have forward posture like this, the neck is bent the wrong way. So that's why, yeah, so there's a lot of research stating that. There's a couple of papers that I also want to be looking at myself. One is the correlation having a good neck curvature and lacking of symptoms for neck complaints. So there's an 18-time increased prevalence if you have a straight neck or a bent forward neck than having an optimal neck curvature. So that's interesting. There's a whole research paper covering that. I want to cover this more in detail in an upcoming paper. There's also a couple other papers. They talk about how the neck influences both the nerve conduction, both the speed of the nerve conduction and the signal quality over that, how it also can improve your balance. So this is covered in this very extensive, there's actually a chapter from a whole book where they talk about this. So this is something I want to cover more in detail itself. They talk about nerve conduction charts and things like this. I will want to go through this in a different paper. I'm not an expert in this area, but I want to read up on it. And then there's a specific paper looking at forward posture and how these signals are getting affected. So yeah, there's plenty of research stating and supporting this structural correction work. Something I want to cover also in future episodes of this YouTube channel is what is the difference between our clinic and other clinics, okay? I'm not sure I can go and interview other clinics per se, but I understand what they're doing is manipulation alone. And they may say that they're doing structural correction. There's a couple of research papers actually stating that manipulation or adjusting your neck on a weekly basis for an extended period of time actually doesn't change the neck curvature, okay? I know this is gonna upset a lot of other clinics doing this, but that's what the research tells me. I'm not a big fan of that. Just cracking alone or adjustment alone, manipulating alone will actually correct your neck. I personally seen clients that gone to these kind of clinics for 3 years and there's no change, okay? I'm not saying that I get 100% of change of my clients all the time. There are cases that I will also fail, okay? But in majority of cases, I can improve the neck curvature in the first few months. Many cases, almost most cases are done in maybe 3 to 6 months, back to normal. So yeah, I think that would be the biggest difference between us. Also, there are research papers that state that once you correct the neck curvature, once you improve it, you will get reduction in your symptoms. But not only that, the research also states that after 12 months after the correction has been done and the patient stops treatment, they actually keep improving. The pain reduction and symptoms keep going down. So that's the kind of this data and that we have to support for this kind of treatment that I'm doing. And I think that's what makes me very different from the majority of other clinics in Singapore. A lot of patients asking, will the treatment work for them? What we can say that when I've done this for past 10 years, yes, there is a good handful of cases that it hasn't worked. Okay, I can't fix 100% of the cases, but for the vast majority of cases, it does work. That's why we like to do exercise after every 12 sessions. We want to quickly see what's working, what's not working for you, how you're responding, how we can improve. Like I said, majority of cases are improving in 3 to 6 months, okay? There are cases that are fixed in 4 weeks, all right? But yes, for the vast majority, yes, this treatment will work. And if we can improve your neck curvature back to normal, you will get great long-lasting relief of your symptoms.